So April is Minority Health Month, and the U.S. Department of Health and Human Services focused on three main goals this year to try and meet: increase health literacy, provide culturally and linguistically competent care, and improve information for patients who have limited English language skills. Bigger picture on this kind of month is to close that racial disparities gap that is omnipresent in America's healthcare landscape. Tonight, we want to focus on one issue in that area, one that's just deeply disturbing: maternal health outcomes. Here's Sharon.
Here's a fact that always exists in the back of Dr. Rahel Nardos' mind.
Every couple of minutes, a woman dies from pregnancy or childbirth related globally. And of those, 95% of them happen in low and middle income countries.
As the director of global women's health at the University of Minnesota, she's keenly aware that those numbers also translate to the United States.
In Minnesota, for example, Black women have 2 times higher risk of dying from childbirth related causes. American Indian communities have 4 times higher risk.
The reason why is the million-dollar question, and one that has a multi-part answer: lack of education, gender inequalities, economic inequities, to name a few.
Minorities lack the resources to have continuous and quality access to care, so those are huge barriers. And even when they do access care, if they're not treated well and with respect and with cultural sensitivity, a lot of people don't feel comfortable seeking care.
Nardo says she sees a lot of female patients bring in younger women companions with them to appointments. The women often act as translators, and Nardos sees them as an invaluable resource that hospitals could potentially tap into.
What would make it better for you to be better advocates for your family? And maybe in the process of doing this, with mentorship and leadership training, they might actually consider healthcare as a field, an area that they can pursue.
As April comes to a close, Nardo says she hopes its designation of Minority Health Month would move people beyond just talk.
I mean, that would be a good use of Minority Month, I think. Yeah, if we could move people to action through the stories we tell.
And action pairs well with the starting point, the theme for the month this year: better health through better understanding. Thanks, Sharon.